Hi there, I'm Amanda and this is Jaimie. Today we'll be presenting some of our findings from our paper, Putting the Self in Self-Tracking, the Value of a Co-Designed How Might You Self-Tracking Guide for Teenagers. The teenage years are a critical developmental period for lifelong health behaviors. However, more work is needed to empower teen users to engage with personal informatic tools to track their health and fitness in ways most relevant to them, their personal motivations, and their needs. Previous work has recognized that teenagers' engagement with PI tools might look different to adults. Yet, studies of teenagers' use of self-tracking tools are still relatively limited outside of intervention settings where researchers prescribe the uses and intended outcomes of PI tools. Now, more than ever, it is critical to involve young people in this research. We need a better understanding of how teens might reimagine the design of educational resources around these tools to fit their purposes, and to identify new opportunities and interactions that such a resource might foster. In this paper, we argue that to better design teens' interactions with health technologies, particularly PI tools, we must think critically about how we design the broader information ecosystems within which these tools reside. The contributions of this work are: first, designing remote co-design workshops with teenagers to gather insights on their needs and questions around interacting with PI tools. Second, identifying design opportunities for educational resources to support self-tracking practices. And finally, demonstrating the value of flexible resources to support teens' decision-making in all stages of their self-tracking journeys. To better scaffold educational resources for teens interested in self-tracking, we broke this project into two series of co-design workshops. We ran 5 90-minute exploratory content co-design workshops with 44 teens in the UK in November 2021, called our Series A workshops, and 2 follow-up 60-minute reflexive prototype design workshops in March 2022, Series B workshops. The Series A workshops focused on how teens engage with self-tracking and where they can benefit from further support. We then took these insights and translated them into mock-ups for a potential Instagram-based How Might You guide for self-tracking. The Series B workshops built off these mock-ups and centered around creating tangible prototypes and guidelines for such an Instagram-based educational guide. These insights were then translated into proof-of-concept Instagram posts created by a graphic designer. We will explore these visuals further in our discussion. These workshops were all run remotely using Microsoft Teams and Miro, and all workshop data were analyzed together using thematic analysis. So, to dive into some of our findings. First, we explore the nuanced experiences different teens have with self-tracking tools and resources in their lives. We are asking the question, who are we co-designing for? There is a decidedly negative tone towards PI from the outset of many of the workshops. Most commonly, teens associated words such as gloomy and stressful with self-tracking. Many of these negative associations centered around potential mental health implications of self-tracking. They felt that these practices could be addictive, possibly resulting in teens becoming paranoid. Our collaborators felt that the online space currently lacked guidance on how to navigate these challenges. Conversely, many teens also saw how these practices could be helpful for keeping fit, monitoring, and staying organized. Many of these positive experiences centered on the promotion of physical health. Our teens were clear that there was a difference between unhealthy and healthy competition. They could clearly see how self-tracking data sat within a broader information ecosystem that could inform their understandings of their body and their health. Teens' open questions about self-tracking centered around 2 key themes: questioning the assumption that self-tracking is good and determining if self-tracking is appropriate. Asking, why are we still using self-tracking devices if we know that they are harmful, especially in this generation? There was no one approach to self-tracking for young people, and our teen collaborators were eager to learn from resources that might help them critically question assumptions about if and how they should be engaging with these tools. So now I'll hand this over to Jaimie to talk about what we are co-designing and why.
Thank you so much, Amanda. Now we turn to think about what educational opportunities teens imagine could be possible in the context of self-tracking. Focus on broad themes and practices in the Series A workshops led us to believe that, if done thoughtfully, a single adaptable resource might be useful for teens without a need to create individual personalised guides for different people or devices. The challenge was how to design resources that were broad enough to capture different experiences, but also personal enough to not be superficial. We focused on two key areas: content and distribution. Teens were clear that they wanted the user guide to encourage nuanced, non-judgmental conversations which acknowledged individual motivations for tracking. They argued that the guide should expand this non-judgmental space to also include parents and schools. They agreed that community building is important for healthy self-tracking practices and suggested that the guide could thoughtfully promote this community orientation. They emphasized the importance of recognizing the context of self-track data. Our collaborators felt that the guide should switch the framing from monitoring numbers alone to more dynamic goal setting, which considers other measures of health and well-being. Finally, our collaborators wanted the guide to address the role of third-party actors. They wanted it to answer questions such as how is data stored, and they sought guidance on how to keep data private from peers and family, but they also wanted to be directed to information about third-party support, such as mental health support. Our collaborators were divided over the distribution methods of the guide, yet ultimately they just needed this information to become available to them. Some believed that schools were useful places to present this information, though in small interactive discussions rather than large assemblies. Whether these discussions should be compulsory or not was controversial, but most agreed that external experts should discuss self-tracking, not their teachers. Many also felt that social media was another helpful place for sharing the user guide, as it was accessible and comfortable for teens to use and had the potential to reach a large number of young people. Teens also appreciated how social media afforded anonymity in accessing this information, and this was the place where many had come across self-tracking for the first time, and so they felt it was an appropriate place for there to be education. Following the Series A workshops, we designed a series of Instagram posts that would be appropriate for young people. We moved away from a practical how-to guide for self-tracking and instead focused more on a technology-neutral and practice-focused how might you guide. We then ran the Series B workshops to understand teens' perspectives on these posts, and an example of these posts and teens' responses can be seen on the screen. Firstly, we thought about audience. Teens acknowledged the complexity of social media as a means of distributing information to diverse audiences, while simultaneously making the content feel personally relevant. They wanted to see themselves reflected in the posts. We then turned to think about establishing a relatable authorial voice. Teens were focused on the tone of content and were eager to see something that was not patronizing. They were keen to hear from someone famous, experts, or testimonials from someone close to their age. Finding the right message was key. Teens felt that it was important for the guide to present high-quality, non-biased information. They felt that an overly negative tone could be patronizing and could compromise their autonomy to make their own choices around self-tracking. Finally, we turned to design considerations. Eye-catching visual designs and images were key for teenagers, and they were drawn to colour schemes that were bold and unexpected, but appeared gender-neutral. The data in this research really celebrates the messiness of teens' self-tracking experiences, and shows us the value and the challenges of creating educational resources for this diverse user group. We highlight three key takeaways. Firstly, educational resources should acknowledge the complexities of health and well-being and equip teens with the autonomy to determine the right approach for them. Secondly, educational resources should celebrate individual differences. Our co-designed guide prioritizes notions of personalization and individual experiences through a balance of professional resources and peer testimonials. Thirdly, educational resources are an important feature of young people's technology engagement. We are not advocating against redesigning tools, but rather are promoting a more holistic information ecosystem to be available for teens to support their interactions with health technologies. As highly inquisitive and reflexive thinkers, our collaborators had many questions around the role of self-tracking in their lives. Our How Might You guide may not necessarily have the answers for all of those questions, but it can help provide teens with resources they can look into to answer those questions for themselves and help them ask new questions. As a first step, taking direct action on the work done in our Series B workshops, we worked with a graphic designer to create a series of 15 proof-of-concept Instagram posts, bringing together the insights from all 7 of the workshops. You are looking at an example of one of these posts now. When designing future educational resources around PI tools, we suggest embracing the messiness of teen self-tracking, whilst ensuring the tone and content remain supportive and non-patronizing to empower young self-trackers. Thank you so much for taking the time to listen to our presentation. We look forward to answering your questions.